You are listening to Kickspot. Let's just kick back at the spot.
All right, what's going on, guys? You are listening to Kickspot. I've got a few friends of mine here who are doctors. Look at that smile right there. Who are doctors.
What's going on?
If you guys want to introduce yourselves.
My name is Patrick Lamb. I'm an anesthesiologist in Los Angeles, born and raised in San Jose, California.
Adam Milam, also anesthesiologist from Baltimore, Maryland, and been here for about 4 years.
And how did you two meet?
We met 4 years ago. We work at the same hospital in Los Angeles.
You guys met here
Yeah,
in Los Angeles.
In Los Angeles.
What was your perception of Pat?
You could tell
question.
Pat was hardworking.
What is it? What's the smile? You're going to smile on your
He was definitely hardworking. He seemed a little bit nervous when he first started.
Okay.
I've seen that dissipate over the last couple of years. But just caring and hardworking. So not qualities a lot of people have.
All right.
Yeah, my perception was grumpy.
I can see that.
I think he had like a grump, like the first orientation. He didn't drink coffee or something. So then I was just like, we're not gonna get along. But then it just changed, and he's one of my closest friends in Los Angeles.
So did you both start at the same time?
Yes.
Yeah.
Okay. So as you guys are going through like the rough patches and stuff, would you guys vent about stuff, or are you allowed? Are you allowed to?
Definitely. You can vent with each other. We don't use patient names and patient information, but we can definitely talk about cases, talk about our experience for a case or during the day. And I think that's pretty helpful to talk through cases and experiences.
So Adam, let's talk about medical school. Where did you go?
So I went to Wayne State in Detroit. Great place. I went to Detroit because it reminds me a lot of Baltimore. Great medical school. You get a lot of good clinical skills. You work at a county hospital during your third and fourth year. And they also gave me a good amount of scholarship money. So,
Did you? Is Baltimore's by the water,
yes.
and Detroit is obviously in the Midwest.
Mm-hmm.
So did you miss a lot of like the outdoor type of things out there?
No, they actually have a lot of outdoor activities in Michigan in general, but definitely in Detroit. There's a big public park that's right between Detroit and Windsor, Canada. It's called Belle Isle. And so you can bike and run around that, skateboard, whatever you want. So there's a lot of opportunities for outdoor activities in Detroit as well.
Awesome. And then Pat, where did you go? Where did you attend?
I went to medical school at Howard University in Washington, D.C.
Howard University. Why Howard University?
In college, I became interested in health disparities, in particular hepatitis B. It impacted Asian and Pacific Islanders 10 times more than the general population. So then that means that a lot of, especially immigrants coming from Asia, they need blood tests, and if they're negative, they need vaccinations. So especially like uninsured patients or like low income, we would give free blood tests. We would do free screenings, free vaccinations for them. And then we would also educate them. It's important to get educated and to know about the disease and how to transmit it. We increase public awareness. So I had this interest. So then when I applied to medical school, I was looking for a medical school with a similar mission statement, and Howard had that mission statement. It works with Howard. A lot of the medical students who go there want to work with the less fortunate, and it also address health disparities. So also I wanted to leave California, go to the other side of the country. It was a big city, Washington, D.C. I would recommend anyone to check it out, to visit, to live, and it was a great time.
I mean, huge difference between Berkeley, typically more, I would say, more Asians, compared to Howard University, predominantly more Black. Yeah. So I was able to pull up some statistics on Howard. And this is just from 2017 as far as for admission. There's 9,392 students and 84.6% Black. And then the next race after that is actually both Asian and white, both each at 2.91%, and which makes it 273 Asian and Black. So obviously a huge difference there in culture. What was that experience like?
Yeah. So when I went to undergrad at UC Berkeley, it was probably 40%. The student body was probably 40%. And then so when I went to medical school, I think in our class of 115 students, we only had like 6 to 8 Asians, and the majority were African or African American. Besides the statistics, I didn't feel a difference. Going to that medical school I felt like a family environment, very supportive. A lot of the upperclassmen ingrained that and encouraged that, and faculty as well. So it really helped me succeed in medical school, pass all my boards, and helped me come out to LA afterwards.
And Adam, why did you want to go into the medical field?
Just, I remember being 10 years old and knowing I wanted to be a doctor. I'm not sure where that came from. And then in high school, didn't really do much about that. And then in college, I started working at the hospital. So I worked at Johns Hopkins Hospital in Baltimore. I worked in the emergency department, and I realized there that, hey, I wanted to go into medicine. I loved what I did there, worked with a lot of physicians, nurses, got to see a lot, interact with the patients. And from then on, I pursued medicine. So I'm not sure where the initial spark came from, but it was definitely ingrained in me when I started working at Johns Hopkins.
And nobody in your family, immediate family, or anybody in
Nobody's in medicine. I'm the first one to become a doctor in the family. So it was a little difficult navigating, but a good process overall.
And would you say overall they're proud of you?
Definitely.
What about you, Pat?
Yeah, I'm also the first doctor in my family. Yeah, they're very, very, very proud.
Okay. Got really quiet after that. They're proud. Okay.
Are you sure?
I know. He's like, my parents told me to say that.
Like they tell their family, they tell our family members, they volunteer information. Oh, he's doing this. Kind of like I think it's to show off or whatever. But
yeah. So, me personally, I don't know much about the medical industry. But when, Pat, you and I met, you said you were an anesthesiologist, and I don't even know if I am currently saying that right. But I really didn't know what that meant. So if you want to, educate the listeners on what that is.
Yeah. So basically, every time someone gets surgery, the day of the surgery, the morning of the surgery, or even the night before, it could be the most, anxious, nerve-wracking, for the family or even for the patients, and also it could be painful. So our job is to make them comfortable, relieve their stress, relieve their pain before, during the surgery, keep them asleep, keep them pain-free, keep them comfortable, and after, when we wake them up. So like during the whole surgical process, we are their eyes and ears in the operating room, and we keep them comfortable and alive.
Yeah. So like Patrick said, we monitor and provide anesthetic care during the preoperative, operative when they're in the operating room, and postoperative period in the hospital. And so people generally think that we're just usually in the operating room. That's what you see on like a Grey's Anatomy or any kind of medical TV show. But actually, we're all over the hospital. So if someone's delivering a baby, we place epidurals for OB patients. We monitor critically ill patients in the ICU. We do regional services where we do different kind of nerve blocks to help with different surgeries and pain procedures. So everywhere in the hospital, interact with every specialty.
So going along with that, obviously during this time, really sensitive time, I don't even remember the last time it's been this bad. I mean, I think the last time I remember would be swine flu, and I don't think it was as drastic as it is now. I mean, the word unprecedented is thrown out there a lot. So obviously you both take a large part and a large role during COVID. So guide me through the life pre-COVID and then the transition during.
Yeah, so pre-COVID, as Patrick mentioned, we really were focused on patients that were having elective surgery. So if someone came in for a hip replacement or a knee replacement, we provide the anesthetic care and then monitor the patient in the hospital. When COVID started, the pandemic was announced in March. Most hospitals canceled all elective cases, so you couldn't come in and get that hip replacement or that knee replacement. And so we were really mobilized to help out with caring for COVID patients. So putting breathing tubes in, placing them on ventilators, and then monitoring the patients in the ICU. So our role has shifted a little bit since the pandemic started.
Yeah, I think our hospital did a great job reallocating resources and preparing for this pandemic, especially when, you know, all the elective cases were canceled. That means that anesthesiologists weren't needed as much in the operating room because there's no work, there's no case, no surgeries. So then they were reassigned to different areas around the hospital to help with COVID patients, like placing a breathing tube in a COVID patient, taking care of them in ICU, placing, you know, intravascular access in different vessels in their body in case they need blood, in case they need fluids, in case they need medications to help their blood pressure. And so I think it was a good use of anesthesiologists around the hospital.
So you don't typically do that then?
So we work in the ICU. There's intensivists. You can do that specialized training after you do your residency program. So a portion of us do work in the ICU, but on a day-to-day basis, we're mainly in the operating room. And so when COVID hit and, you know, we have a lot of COVID patients, there's an influx of patients, we shifted and, you know, assisted with patients in the ICU. We're doing more airways just because it's a respiratory disease and people need a breathing tube. People need to be placed on a ventilator. So we're helping a lot more with that.
Yeah.
So I'm going to give you some statistics with COVID. Currently in the U.S., there's 1.5 million confirmed cases, 263,000 luckily recovered out of the 1.5, and then 89,000 deaths. And here in LA County, you have 36,000 confirmed and about 1,800 deaths. And I'm sure as you're going to school, you have you know, different friends in different areas. So what are you hearing in their locations? Is it similar to here in LA County? Is it different? What are you hearing?
Yeah, so I went to medical school, as I mentioned, in Detroit. And Michigan got hit harder than California, and Maryland as well, and Baltimore, where I'm from. And then I have a lot of friends in New York. So those places were hit pretty hard, and they had an influx of patients all at once. So there were problems with PPE, problems with space for patients, limited number of ventilators. So we didn't have the surge that other places had, and we actually were fortunate enough to have a lot of resources. But places, like I said, Detroit, Chicago, Baltimore, really, New York, of course, really had a lot of patients and had a difficult time trying to manage the number of patients.
Yeah, in California, I think we were like the second state to get like the first case after like Washington.
Yeah.
But then the surge happened after New York, so I think the governor closed down the state earlier, you know, stay-at-home orders, and then we haven't seen the surge, and then our hospital, you know, became much more prepared because they saw what was going on in other states. And then so, you know, at our hospital, we have like COVID designated units. We have COVID designated, you know, ICU teams. We have COVID designated, you know, ventilators, nursing staff. And then so we have all these resources that fortunately we didn't have to use all of them and reach or exceed that capacity. So we didn't see the surge like New York saw. And I think we're fortunate to have seen that.
So being at this hospital, in my eyes, it's one of the most popular hospitals. So obviously, in my opinion, resources are more abundant. But I'm sure you've heard of cases where there's not enough masks. Adam, you talked about ventilators not being accessible. What is that experience like, not having those masks and people are having to make masks like within the hospital?
Yeah, so in the beginning, a lot of hospitals just didn't have the resources for the influx of patients. Fortunately, here we always had enough PPE, but in other places I've seen people making their own masks, reusing masks.
In the hospitals?
In the hospitals, figuring out how to sterilize masks so you can reuse them. So that was definitely an issue. I think the manufacturers have caught up now, and that's not as big of a problem as it was in the beginning. But when we had that huge influx of patients, no one just had the allocation of those masks and other PPE to handle the surge.
Yeah, it's just great to see how selfless, U.S. like the Americans are. I have nursing who are making masks in their home and sending them out to New York or Washington to help them out. So whatever can get the job done, and it's definitely very helpful, especially in low resource areas.
So people talk about the new norm. We've talked about the previous pre-COVID, during COVID. Now, what does the new norm look like? Not just in the medical industry, but as far as for everybody outside the medical industry, in your opinion?
Yeah, I think social distancing will be the norm moving forward, at least for this year. I think we'll likely see another surge as states are starting to reopen. And so I think there will be certain precautions put in place. I mean, if you look at some of the pictures in some of the Asian countries, they have dividers in between the treadmills and the ellipticals. And we may see,
they do.
Yeah,
I have not seen that.
We may see some things like that. And then a lot of things we realize that we don't have to do in person. A lot of telehealth is happening, and other things are happening that's not done in person. That meeting that you thought you had to go to in person, you don't need to. Zoom is okay, or a phone call is okay. So I think things will shift slowly, but I think they will shift.
Yeah, like wearing masks everywhere you go, better hygiene,
So
more responsibility.
Yeah, so in the state of California, obviously there's different phases that the governor's initiating as we open up. But with what you're seeing currently, I know there's new cases with now kids getting some type of, I don't know if it's called disease or some type of
some kind of inflammatory response. We don't
yeah.
exactly know what it is.
So that's obviously happening in New York. I don't know if you know of any cases here. Maybe it's in the Children's Hospital. We just don't know. But what should everybody be doing besides social distancing? I mean, me going into a restaurant, for example, like what is the response? What should I be doing? Like, should I be going into restaurants? Like, I don't even know personally.
Sure. So I would advise against leaving your house unless you have to. So, of course, some people have to go to work, and it's jobs that they have to go to. You have to leave the house for grocery stores, leave your house to exercise. But until we have a better grasp on the virus, until we have a vaccine, I would stay at home as much as possible. Do your social distancing. Like Patrick said, wear your mask, hand sanitizer, frequent washing of hands. But we just don't know enough about the virus, and we don't have a vaccine at this point. So it's tough to start to reopen.
Yeah, and like whenever phase 3, for example, in California will happen, they're gonna slowly open restaurants. But then when they open restaurants, they're gonna take precautions. Like they're not gonna open like every single table at the restaurant for everyone, and eventually we'll go back to normal.
So what I've been reading is that there's when the restaurants are going to open, there's going to be obviously different policies and procedures, not just from the customer's perspective, from the employee standpoint. They have to go through new training, how to handle customers, and obviously it's going to be very, very sensitive. And there's probably a lot of listeners that are also listening to this and saying, screw that. We got to get the economy going, and we're already noticing that around the nation. Different states playing a different part in that. And so obviously come from the medical background, you're seeing this firsthand. So I could see that perspective of, we just got to social distance, don't go out there. And then from the other perspective, for the capitalists that really want to, get the economy going, I could understand that perspective as well too. So very, very different. I think this has really set a very big divide.
Sure.
Within perspectives, which kind of sucks because during this time we should be unifying and trying to figure out a solution to really move forward and not create that divide. But I appreciate you talking about what, as far as for the medical side, what your perspective is.
You are listening to Kickspot.